Hi, I am Dr. Jaiswal. I am a chief neurologist practicing at KIMS Hospital, Kondapur. Today, I would like to share signs and symptoms of the very dreaded condition stroke. Now, what do you mean by stroke? Stroke is something which hits you suddenly, it handicaps you, it causes weakness in your hand or leg or vision, or it impairs your speech, and a recurrent of stroke can affect your memory. So, what are the common causes of stroke? What are the common symptoms of stroke? And how we should identify them? And how do we go about and seek medical attention so that we can minimize the damage caused by these stroke symptoms? So, when you say stroke, you mean something which hits you. It is something like a heart attack. They use the term brain attack. When you say heart attack, there is a blood vessel which is going to the heart which gets blocked. Similarly, when you say it's a brain attack, it's a blood vessel which is going to a particular part of the brain and blocking it, and then it causes signs and symptoms which are related to the area of the brain which is affected. Now, because we know that there are different areas of the brain, there are areas of speech, there are areas of vision, there are areas of memory, and there are most importantly the areas of the power and sensation of the hands and legs and the balancing system. Now, depending upon the area of the brain which is not receiving the glucose or the oxygen properly, and the blood vessel to that area is blocked, you develop the signs and symptoms and you call it a stroke. The most important thing is identifying the stroke. So, you say, do you have to do it fast? So, when the patient has, when you say F, it is something to do with the face. You have a look at his face, you see if there is asymmetry in his face, you feel that there is a drooping of his lips or the face muscles on one side. Secondly, the patient is unable to speak properly, articulation. Speech of the patient is affected, or the patient is unable to stand, walk, and the stability of the patient is lost. These are very simple and early signs of stroke. You should not miss them. And these are the signs and symptoms with which you have to seek a urgent medical attention, because if you are going to minimize the damage to the brain, because with each minute counts, with every minute there are millions of cells which are going to die because of lack of oxygen and glucose. So, if you take such a patient to a center which is nearest to you and which is equipped with taking care of stroke patients, that is fantastic. So, if you are fortunate enough to have such a center near around, and we are able to take the patient to such a place in the thing called window period. Now, what is this window period? Now, window period is say about 3 to 4.5 hours. That is the time when you can give these patients something called the clot buster therapy, or in certain situations you do further investigation and try to remove the clot. So, you do a clot buster therapy or you do a clot evacuation therapy. Now, this has to be done in the window period, because with each minute number of neurons are dying. So, if more number of neurons are dead, the end result will be poor. So, you need to attend these patients at the earliest and you have to minimize the damage to the neurons. So that is the reason why you have to seek a medical attention at the earliest. Now, who are the patients who are going to develop these strokes? The grim side I have discussed, but let's look at the positive side. Age is a risk factor. Patients who have diabetes, hypertension, who are smokers, and then who are using alcohol unreasonably. Now, these patients are at a higher risk of developing a stroke. Now, in these situations, you have to be very, very careful. You have to seek the medical attention at the earliest, because these are the risk factors which don't add up, they multiply. So then 2 and 2, 4, it becomes 16. So your risk if you are a smoker of stroke is very, very high. If you are uncontrolled diabetes, uncontrolled hypertension, with a past history of having suffered from a heart attack or a brain attack, the risk of you developing a stroke is very high. So in these situations, you have to be extra cautious and seek a medical attention, because time is brain. With each minute passing by, billions of neurons they die, and then you will not be able to salvage them. So if you want to salvage them, you have to intervene early, and by God's grace we have methods to intervene early with clot buster therapy, or you just do the plumbing. You remove the clot from the blood vessels and you remove the clot in time. These procedures are not really dangerous in the true sense. Yes, there is some risk involved when you do these procedures. These are heroic procedures. There is some risk involved. But then, if you don't attempt to save the brain, the rest of the life of the patient is going to be miserable. That's why it is highly advisable that you seek a medical attention at the earliest, and then you must see that the patient gets the clot buster or clot evacuation treatment, and then you are able to salvage the neurons, because there is lot of neurons which they take the function of the dead neurons. So if you have minimum number of neurons which die in this process of stroke and you are able to salvage them, then the end result possibly be very, very good, and subsequently the activities of the daily living of the patient will be good. The patient will be still, he can continue to be the bread earner for the family, and then we can have a reasonably good life even after you have suffered a stroke. Thank you.